Hello, everyone, and welcome to episode 2 of Social Issues in the United States. Can anyone guess what the social issue I'm going with today is? That's right, healthcare. How the healthcare system of the United States compares to the world. Is it failing? Is it succeeding? That is what we are going to talk about. After World War II, with the Axis powers defeated, most Allied countries of the First World decided to change how they were doing things. One way they did this was by instituting some form of a national or single payer healthcare system, called the NHS or National Health Service in the UK, or Medicare in Canada. What many people don't know is the United States tried to do the same thing, but failed, with President Truman in 1945 proposing a national healthcare system for America. That effort eventually became the system of Medicare the United States has today. But unlike Canada's Medicare or the UK's NHS, America's Medicare only covers Americans ages 65 and over, which has consequences. We will talk about those in a bit. So, what is the difference between this type of system and the system of privatized health insurance for the majority of Americans in the United States? Let's look at some data. One way the American system differs substantially is in cost per capita. When comparing this to other countries of the First World, we see the United States is a significant outlier. Let's take a look at an article on healthsystemtracker.org. This infographic shows us that the average cost in US dollars of healthcare per capita of other wealthy countries, such as those in Europe, Australia, or Canada, is $5,697. Now contrast this with the United States with a cost of $10,966, and you can see what I mean. Plot this on a chart comparing spending per capita to GDP, and you can see how far away from the pack the United States lies, as it spends essentially twice as much per capita on healthcare as the average of the non-US first world countries. More than double our neighbors to the north, Canada's 5,418, and the UK's 4,653. So, we spend a lot of money on healthcare in America. What does the average American get for all this spending? Let's look at a CommonwealthFund.org article from January 2020. This information is according to data from the Organization for Economic Cooperation and Development, or the OECD for short. Highlights of the data show that the United States has in many metrics significantly worse outcomes than the 10 other countries measured. The US spends more on healthcare as a share of the economy, nearly twice as much as the average OECD country. Yet despite this, has the lowest life expectancy and the highest suicide rates among the 11 nations. The US has the highest chronic disease burden and an obesity rate that is 2 times higher than the OECD average. Americans had fewer physician visits than peers in most countries, which may be related to a low supply of physicians in the US. Americans use some expensive technologies such as MRIs and specialized procedures such as hip replacements more often than our peers. The US outperforms its peers in terms of preventative measures in some areas. It has one of the highest rates of breast cancer screening among women ages 50 to 69, and the second highest rate after the UK of flu vaccinations among people 65 and older. But compared to peer nations, the US has among the highest number of hospitalizations for preventable causes and the highest rate of avoidable deaths. Many of these issues may stem from the fact that Americans don't go to the doctor as much as other countries. But while fewer physician visits may be related to fewer physicians, it is unlikely to be the primary cause. Again, comparing the US to Canada, in Canada they have similar amounts of physicians, with 2.7 per thousand citizens, compared to the US at 2.6. But Canadians visit the doctor nearly twice as often, at 6.8 visits on average, per capita, compared to the US at only 4. Again, while spending less than half of what the US is spending. This is likely due to simple economics. When you're struggling financially and have to pay to see a doctor, you're less likely to do so. Even if the cost isn't high, any cost at all will reduce the likelihood of seeing a doctor. To see evidence of this phenomenon, we refer back to one of the consequences of Medicare I mentioned earlier, limiting coverage to those 65 years old and older. Take a look at cancer diagnosis. According to an article from Stanford University, when analyzing data from hundreds of thousands of patients in their 60s, there is a significant jump in cancer diagnosis at age 65 compared to surrounding years. Joseph Schrager, MD, is quoted as saying, quote, "There was no reason rates should differ much between the ages of 63 and 65, end quote. Theorizing that the cause was patients choosing to wait and see a doctor, he continued, quote, "If this were true and patients were delaying screening or treatments for cancer, it could impact their survival," unquote. The data of the article shows the most significant increase in colon cancer, quote, which showed an annual growth rate of just 1 to 2% in the years leading up to Medicare eligibility, but jumped to nearly 15% at 65. In the years following 65, diagnosis rates declined for all cancers, the study found, end quote. The data indicates that 61 to 64-year-olds wait to get cancer screening, perhaps because they can't afford the treatment until they're covered by Medicare. In addition, with research published in the November 2020 issue of the medical journal The BMJ, showing a statistically significant increase in hazard towards the survival rate for every 4 weeks treatment is delayed, we can conclude that more people are dying in the United States due to the decision to delay treatment until Medicare coverage is attained. Despite all of this, many people argue against a single-payer system for the United States, suggesting it would result in long wait times for treatment. But even if this were true, and other countries like Canada and the UK had such wait lines, it still ends up being better for the average citizen than the data shows is currently the case. Referring back to Commonwealth Fund's data showing that the US has the lowest life expectancy, the highest mortality rates from avoidable deaths, and the second highest rates of hospitalizations from preventable causes, second only to Germany. Now, even considering all of this information, you've probably heard, as I have, the praises sung about how the United States healthcare system is the cutting edge and the best in the world, and that people from single-payer healthcare countries come to the US seeking the kind of care that you can only get here. Even if the United States is the best healthcare in the world, it is only that for those of us who can afford it. I'm going to briefly read the latest post from Reddit's forum, Off My Chest, posted just a few days ago. F the American healthcare system. I have an autoimmune disorder, and with all the treatments I am supposed to receive comes the fight with my insurance company. I'm supposed to get infusions. Insurance says I don't need them. I have to get an MRI to look for the possibility of a CFS leak, cerebral spinal fluid leak, but the insurance says they don't think it's necessary. I get blood taken every few weeks, and every time I do, I get bills for hundreds of dollars. Why is it that only people who have a large disposable income get to receive healthcare without worrying about how they're going to pay for it? How is that okay? People say that America is, quote, the land of opportunity, yet the cost of an ambulance in my area is almost $10,000 because insurance won't cover it. I recently had skin cancer, and even then, insurance didn't want to pay for it. The worst part is that my insurance isn't even that bad. I feel for the people who have worse coverage than I do. It's so ridiculous that people have to fight to get things like insulin or chemotherapy. Things like mental health concerns often don't exist according to health insurance companies. This shouldn't be acceptable in a country like America. This shouldn't be acceptable anywhere. That was from user Under the Winter Sun, and I agree with him. It is unacceptable that our healthcare system only works for the few who can afford to use it. If we as regular Americans truly care about saving money, saving lives, and receiving better service, then something needs to change. The advantages of a single-payer healthcare system to the overall health of a nation in both financial and physical terms are clear. We need to catch up to the rest of the first world and help our people live longer, happier, healthier lives. What kind of a world do we want to live in? Because it's up to us. Thank you all for watching. Until next time, this is Jonathan, signing out.